Welcome to Family Caregiving for Older Adults. In this lesson, we will explore normal versus abnormal aging with special attention to physical changes. Our goal is to learn a reliable way to notice change, describe it clearly, and decide what level of attention it may require. We will also correct 4 common myths regarding memory loss, falls, pain, and personality stability. Aging is universal, but it is not uniform. 2 people of the same age may have very different strength, hearing, balance, and independence. Even within one person, the body's systems do not all age at the same speed. Aging is a multidimensional process. Genetics influence traits, but lifestyle, environment, and social purpose matter just as much. Chronic conditions and medications also shape what appears to be an age-related change. Let us begin with the musculoskeletal system: muscles, bones, joints, posture, and balance. Beginning in midlife, skeletal muscle mass and strength tend to decline. This is an average, not a personal prediction. Research estimates a loss of roughly 1% of muscle mass per year beginning around midlife. Inactivity accelerates this decline. Muscle helps a person rise from a chair, climb steps, and protect joints. The encouraging news is that regular resistance exercise can slow loss and improve strength in many older adults. A complete plan often includes strength, balance, flexibility, and aerobic activity. Think about function as a series of everyday tests. Can the person rise from a chair without using both arms? Can they carry a light object while walking? Documenting functional change helps the care team. Sudden weakness, especially on one side, requires an emergency call. Repeated falls, a new shuffling gait, or frequent near falls deserve prompt medical evaluation. Do not wait until a fracture occurs. Pause and decide. Mrs. Alvarez has become gradually less steady over 6 months and has had 2 near falls. Is that normal aging that can wait indefinitely? A yes, B no. The answer is B. Arrange a timely clinical evaluation. Gradual does not mean harmless. Repeated instability deserves assessment and prevention. Falls are common, but they are not inevitable. Skin becomes thinner and drier with age. This increases sensitivity to heat, cold, and friction. Older adults may not adjust to temperature extremes efficiently, and healing may take longer. Caregivers can support skin health by moisturizing regularly and checking for pressure points like the heels or sacrum during personal care. Prompt action can prevent a much deeper injury. A wound that is not improving or a mole that changes size or shape should be reported. Call 911 for rapidly spreading redness, fever, or blue or gray lips with breathing difficulty. With age, arteries may become stiffer and the heart has less reserve during exertion or illness. Maximum heart rate and aerobic capacity tend to decline, but severe breathlessness is not normal aging. Heart attack symptoms can be subtle. They include chest pressure, back or jaw pain, nausea, and unusual fatigue. If symptoms suggest an emergency, do not wait. Call 911 immediately. Pause and decide. An older man becomes short of breath while sitting and says his chest feels heavy. What should the caregiver do? A. Let him rest. B. Call 911. The answer is B. Call 911 and follow emergency instructions. Symptoms at rest with chest heaviness may be life-threatening. Do not drive the person yourself unless directed. Sensory changes affect communication, appetite, and balance. More light may be needed for reading, and hearing often becomes less sensitive to high-frequency sounds. Shouting can distort speech and feel disrespectful. Adaptation is not giving in to aging, it is preserving independence. Simple steps like better lighting, treating earwax, or adding contrast to steps can prevent a cascade of isolation and falls. Sudden vision or hearing loss, eye pain, new flashes or floaters, or sudden double vision requires urgent evaluation. Reduced sensation also increases the risk of unnoticed burns or foot injuries. Digestive processes may slow, but severe constipation or significant weight loss is not normal. Sleep patterns also shift, but persistent daytime sleepiness or loud snoring should be discussed with a clinician. Medication review is essential. Many common drugs can affect bowels, balance, and alertness. Bring every prescription, vitamin, and supplement to the review, and do not stop a prescribed medicine abruptly. Severe memory loss is not normal aging. Dementia is a disease process that interferes with daily life and requires a search for causes. Occasional misplacing an item is normal. Becoming lost in familiar places is not. Occasionally searching for a word is common, but repeatedly getting lost in familiar places or unable to manage previously handled bills is a warning sign. Sudden confusion requires prompt medical evaluation. Personality generally remains stable. New aggression, profound apathy, or sudden paranoia should prompt a clinical evaluation for delirium, depression, or other treatable causes. Depression is not a normal part of aging. Pause and decide which is more consistent with typical age-related forgetfulness. A. Forgetting an appointment and remembering it later. B. Repeatedly getting lost on the way to a familiar store. The answer is A. Occasional retrieval difficulty may occur. Loss of familiar navigation is a clear warning sign. Remember, memory changes that disrupt daily function require medical evaluation. Use our 4-level response system. Monitor for mild changes, schedule for persistent ones, and seek urgent or emergency care for red flags. Do not delay an emergency call while searching for paperwork. Use the SBAR method when calling your clinical team. Situation, background, assessment, and request. This helps professional caregivers understand exactly what changed and what is needed now. As a family caregiver, your role is to notice, compare with baseline, and seek the right level of help. Respect aging, but do not blame aging for every symptom. Thank you for joining us today. Continue your learning at famcareclass.com. Your informed attention can protect comfort, independence, dignity, and life itself. Goodbye.